Statistics are alarming. Suicide is the second leading cause of death for high school teenagers and the third leading cause of death for middle school age children. We're talking 10 to 14. So how do you spot the red flags? I mean, how do you know if your child needs professional help? Joining us now is Kathleen Thomas, Behavioral Health Outreach Coordinator at Baptist Health, as well as Jessica Winberry. She's the Program Assistant for Safe Kids of Northeast Florida. Good morning to you, ladies. An important topic. It is something I think that we don't necessarily anticipate. We think about talking to our kids about bullying and making good grades and not drinking and driving and staying away from any substance abuse or drug abuse as an example. Mental health is a little more difficult to figure out because, Kathleen, the reality is, as you know, I'm sure with these classes, is that parents are coming to you and they're basically saying, well, how do I know that this isn't my teenage daughter, for example, going through hormonal changes, or this is her really screaming out and needing help?
Well, first of all, we want to thank you for having us here today to have an opportunity to talk about this. One of the things that we try to convey to the families and to the people that attend our class is that adolescence is a period of turmoil, but the difference when we're dealing with a child who's in crisis is there's, over time, there may be an impact in their functioning in school and in their social relationships, their families. And so what may begin, or what normal adolescents may have a few days of down moods, most everyone does there. They may have some alterations in their mood, but when that begins to impact their functioning, that is a real red flag.
So not just when you pick your child up from school and they're like, oh, school was terrible today, and they say that same thing for a week. That's not necessarily a time to say, uh-oh, something's majorly wrong here. But when you start saying, for example, start seeing an impact when it comes to their grades.
Yes.
Not wanting to spend time with friends, withdrawing themselves, as an example.
Very much so, yes. Those are all key things, that they're isolating themselves more. They're not interested in doing well in school or in any of the other activities they used to be interested in. And they begin to sometimes decline in their way they take care of themselves, sleep more or sleep less, but it begins to have an impact on their functioning.
Are there certain, Jessica, kind of risk factors involved then typically? I mean, is there the typical kid that you would anticipate maybe parents are divorced or they're not being raised by a mother or a father, but maybe a relative, that maybe create an environment in which they maybe are at a heightened risk to having mental health issues?
Unfortunately, there are lots of risk factors, and there are also protective factors. So some of the risk factors are exactly what you said. Any type of trauma in a child's life increases their chance of a mental health issue. Trauma, what's trauma? Trauma to you is different than trauma to me. So experiencing a divorce, being bullied in school, having other types of things that go on in their life, maybe not having the financial resources to have meals every day or sit at home with their parents and have dinner at nighttime. Those are all risk factors that kids can experience in our society. In 2015, Baptist Health did the Community Health Needs Assessment, and mental health emerged as one of the most important things going on and being assessed as being important to our community.
It is so hard also to assess when it comes to your child because every child is different, correct?
Correct.
And that said, is this a class then specifically where it's an intervention for teenagers, or this is just a class that is offered for free to the public that's just for parents?
Well, the class is actually offered for anyone who's interested in reaching out and helping a teen. It can be parents, it can be clergy, it can be school members, and the focus is on helping them identify early warning signs and that a child may be experiencing a mental health challenge, also helping to learn some key strategies to assisting the child and helping them find professional help when appropriate.
It's interesting too because in looking at the types of issues that the class addresses, Jessica, so anxiety, depression, substance abuse, which you would expect because those can lead to depression as an example, but also eating disorders and ADHD.
Yes, we see all those things, and it's really important for people to just have an understanding. After the class, of course, people are not going to be able to diagnose, but they're going to have an understanding of what kids are going through and what things are out there, what things are happening with kids, so that hopefully they can see some early warning signs. The earlier we can assess these problems and get them help, the better their outcome is, the better chance that they're going to have a successful future.
So it's interesting because as a parent of a 12-year-old and a 9-year-old, I like to think that because it's been a long time since I was a teenager, that I understand what my child is going to, experience in in high school as an example. Is this a preventative kind of class, or is this really for parents and caregivers who are recognizing maybe that their child is in crisis and this is a class for them to attend, or is it both?
It's really both. There's a lot of prevention in this class, and just seeing, let's say you're a teacher, do you see something changing in this child that you've seen for the entire year? And just kind of seeing some of those red flags. It's also just awareness. We want to destigmatize mental health. There's a real stigma associated with mental health. Lots of people aren't sure what to do with it. Parents aren't sure how to address their child, what they should do. They don't want to have the stigma put on their child, but there may be help, they might need help.
And get it now, and it is free, which is a fantastic. Thank you, ladies, for being here. It's such an important topic because we love our children and we want to certainly protect them, sometimes from themselves, quite frankly, because they just don't know. They're young and inexperienced. So to learn more and to register for the Youth Mental First Aid Training class, which is what it's referred to, you can go to youthfirstaid.eventbrite.com. I know that's a lot of information. We will post it later this morning on news4jax.com, or you can call this number. It's 202-4302. And we will, again, post all of this information later this morning on the morning show page of News4Jax.